Through philanthropy, Ideas with Impact supports our brightest researchers with the vital early stage funding they need to develop world-class ideas that really address global challenges. So the University of Manchester is a research powerhouse. It's got a history of world-changing innovations that really do put it amongst the global leading research institutions. Ideas with Impact supercharges the best ideas coming from the university in order to create successful businesses with genuine global impact. It's been developed together with the Innovation Factory, and it's the essential first phase in the development of the next generation of the University of Manchester spin-out. You'll have the chance to use both your expertise and knowledge to help create and shape future commercial opportunities.
The mission of the University of Manchester's Innovation Factory is to create positive social, economic and environmental impact from the university's IP and research. In the last 3 years, the Innovation Factory has created 31 new spin-out businesses and generated £9.8 million worth of first-time investment and £155 million of follow-on investment. These philanthropic funds will help us build product demonstrators, understand the market and also customer needs. It will also help us run trials so we can gather more data and understand the real-world benefit of the technology, where it can be commercialised by the Innovation Factory team.
This research study is called TalkMore, and we're developing a device to monitor talking time to help people with their speech recovery after brain injury such as stroke. We really want to encourage stroke survivors to talk much more, to feel more confident about their speech, to be able to go back to work and really improve their quality of life. The Ideas with Impact funding has allowed me, a health professional, to work with somebody like Patrick Gajewski from the Department of Engineering. So it's allowed us to work together to take this really early idea and make it a reality. We want to make sure it's reliable so we can really start to develop it and then embed it within the NHS and use it within clinical practice. We don't have very much data on talking time for the average person, so we want to explore talking time for people and look at talking time for people recovering from brain injury. But we also think it's got potential in tackling loneliness that can have a huge adverse impact on people's health. So we want to explore how it can really support people in becoming more socially engaged.
DAIL stands for Domestic Abuse Lived Experience Support. The hub is a platform where organizations such as healthcare and religious organizations, community groups, professional domestic abuse services can be together to provide all the services that somebody experiencing domestic abuse will need. It is anonymous and it has safety feature that makes it very easy for people to not have to log in, and they don't have to provide any personal identifiable information beyond what they've already registered on their phones. We need to be able to generate that data, the impact data that we need to show where we were before the baseline data, what was happening, how the app is helping people and what the direction is. And we believe that this funding obviously starts that process for us. We also see opportunities for paid internship. There will be opportunities to create jobs in the communities and the local areas. DAIL's Hub helps people to seek help early, and that way we know that businesses are looking after the well-being of their employees, making sure that they are healthy, making sure they have the tools and the opportunity to seek professional help for what they need, and we think that's very important.
Our project has been to develop an early screen for lung cancer. We've been sampling the nasal cavity, and we've come up with 5 or 6 different proteins that indicate the patient needs to go for further screening. The challenge of our research is to try and capture patients before they develop late-stage cancer, which means they cannot undergo surgical resection. Funding from Ideas with Impact is extremely important to help us unravel some of the feasibility issues associated with the development of our test. Commercial potential is that this assay becomes embedded within the NHS. Ultimately, this test will travel across the globe, and it will also be applied to patients who may suffer from the development of lung cancer due to environmental and occupational pollutants.
As an Ideas with Impact founding partner, You'll have the chance to use both your expertise and knowledge to help create and shape future commercial opportunities. Your philanthropic support in early research and innovation will ensure that the ideas in Manchester not only deliver huge impact, but also fulfil their commercial potential. We really look forward to working with you.